Hey everyone, my name is Tricia Thomas. I am the owner of Devoted Healthcare Consultants. I'm an RN. Been an RN now for a number of years, 26 to be exact. Um, and I am just here, just coming to speak with you about starting a home care agency and why it is a good thing to do. A lot of people are trying to figure out, how do I start one? And I was just thinking, I said, well, let me just do a video just to introduce myself and to see if I can be of help to anyone out there that may be thinking about starting one. So first of all, you have to think about in your town where you live, in every state in the United States, the rules are different. You have to take a look at your Department of Health and to see what is the rules and regulations for your state. The fees are different for the application process, and the process may be a little bit different in every state. But first of all, you have to look into, like I said, look into the Department of Health. You can try there to see in your state if that's where the rules are. And it will let you know, do you need to have an RN on staff? In Georgia, you do need to have an RN on staff, but in a lot of states, you don't need to. So let's just start with explaining what the difference is, because in some states you may hear home health agency, you may hear non-medical home care agency. So the one I'm speaking about today is a non-medical home care agency. So with home health is consists of having RNs, LPNs, therapists like physical therapists, occupational therapists, is the MD involved, and they do what you call skilled nursing and skilled nursing, skilled therapy services. So with a non-medical home care agency, you're dealing with CNAs, maybe home health aides, private duty, like sitting, which are sometimes done by CNAs or just by a lay person that's trained on how to take care of someone in a home setting. And they may spend a number of hours, maybe like 4 hours a day. They will stay at the home or wherever the patient's home is, whether it be in an assisted living or in their personal home or their child's home, maybe if they live with their kids. The person will go out and stay with the patient, or we won't call them patients, we call them clients, to stay with them and take care of them, and they will help with, say, bathing, getting dressed, medication reminders, also like transfers, like from sitting to standing with a walker, ambulating them to the bathroom and stuff like that. That is non-medical home care. Home health is a home health agency. They'd have nurses like RNs will go out and do like wound care and IVs and teaching them about medications and stuff like that. And you have therapists that go out and work with them and teach them how to walk again. If they had a fall and broke their hip or something like that, they will go out and teach them how to walk again and do exercises with them. That is home health agency. So what we're speaking about here is a home care agency. And you have to have a license in most states to run a home care agency. And in some states, you do have to have a registered nurse on staff that will write the care plan for the aide that, or the caregiver that's going to be in that patient's home caring for them. So the next thing you have to do, first of all, is to start with a business. You have to have like an LLC, S Corp, but that's a whole nother video to explain how to start a business. You do need to have like an EIN number and so on. That's all under business. But the application process for a home care agency could be a little lengthy. Sometimes people hire someone to do the paperwork for them, or they can just try to sit down and do it themselves, and it can be done. You do have to get fingerprinting, so on in some states also, to make sure that a person may not be, have any criminal background, also for the staff. So that's pretty much how it started. You are allowed to get paid from private pay, and you also can, also bill to Medicaid if that is what you decide to do. Well, that's another process, and in some states you do have to be in business as a home care agency for more than a year. In Georgia, that is the case. Excuse me. So I just wanted to touch base and say hello. My name is Tricia Thomas again, and I am in the Georgia area, and I do help people that are aspiring to open a home care agency in Georgia and also in other states if you need my assistance. My website is devotedhealthcareconsultants.com, and that's devotedhealthcareconsultants.com. And I also have an ebook available for you called Home Care Profits if you're interested in learning about how to start a home care agency. So you can go again. My name is Tricia Thomas, RN, and my website is devotedhealthcareconsultants.com. If you're interested in purchasing an ebook, you can go to the website and take a look at it. And if you would like to have a session with me, you can reach out to me at info@devotedhealthcareconsultants.com. Take care now. Bye-bye.